Welcome back to Inside Chlorpromazine, the podcast where we have taken a deep dive into the science, applications, and potential of chlorpromazine. Over the course of the last 19 episodes, we have explored everything from its mechanisms of action to its role in COVID 19 and even its potential as an antiviral agent. As we come to the final episode of this series, we are going to take a step back and look at the bigger picture, the future of chlorpromazine. Could this decades old drug find a new lease of life in modern medicine, bridging the gap between the psychiatric and infectious diseases? Welcome, Chaitanya.
Thank you for having me, and it's been a pleasure to be part of this journey. Chlorpromazine is truly a remarkable drug, and I'm excited to talk about its potential future.
Let's start by recognizing the legacy of chlorpromazine. It's been in use since the 1950s as a psychiatric medication, revolutionizing the treatment of schizophrenia and bipolar disorder. How would you describe its journey in the world of psychiatry over the years?
Chlorpromazine was a game changer when it was first introduced. Before its discovery, psychiatric patients were often treated with invasive procedures like lobotomies or were left in institutions with minimal care. Chlorpromazine, as one of the first antipsychotic medications, helped to change that by making it possible to manage symptoms of schizophrenia, mania, and other mood disorders without the extreme interventions that were previously used. Over the years, though, new antipsychotic drugs have been developed, particularly the antitypical antipsychotics, which tend to have fewer side effects. However, chlorpromazine is still used today, particularly in low-income settings because it's affordable and has a long track record of effectiveness.
Now, we are seeing chlorpromazine being investigated for its antiviral properties and immune modulating effects, as we have discussed in previous episodes. What's the potential for chlorpromazine in the future of medicine?
The potential of chlorpromazine in areas outside psychiatry is incredibly exciting. In recent years, we have seen it used as repurposed drug for viral infections, particularly in the treatment of COVID-19. Its ability to modulate the immune system, reduce inflammation, and block viral entry into cells opens up new possibilities for its use in infectious diseases. What's also fascinating in that it's a cheap, off-patent drug, which makes it accessible, especially in low-resource settings. The COVID-19 pandemic has highlighted the urgent need for affordable and accessible treatment, and chlorpromazine fits that need perfect.
The most intriguing possibility for chlorpromazine's future is its ability to bridge the gap between psychiatric and infectious disease treatments. Chlorpromazine is antipsychotic, but it also seems to have properties that could impact viral infections and immune responses. Could you expand on this idea of it serving dual purpose?
That's an excellent point. Chlorpromazine is a unique drug because it operates at the intersection of psychiatric and infectious diseases. It's a dopamine receptor antagonist, which is why it's effective for treatment schizophrenia and other psychiatric disorders. But the same mechanism that helps in mental health also affects cellular signaling pathways involved in immune response, viral entry, and cellular trafficking. As we have seen, chlorpromazine can modulate the immune system and alter viral replication. This ability to target both neurotransmitter and immune pathway makes it a potential bridge for treating neurological and infectious diseases together, especially considering that neuroinflammation is often a component of both psychiatric disorders and viral infections such as COVID-19. For example, in the case of long COVID, which affects many individuals with neurological symptoms like brain fog, fatigue, and headaches, chlorpromazine could theoretically help by addressing the inflammation while also improving neurocognitive function.
As we look ahead, what kind of research do you think will be crucial in unlocking the full potential of chlorpromazine in modern medicine?
There are several key research areas that need to be explored for chlorpromazine to be fully understood as a repurposed drug. First and foremost, we need clinical trials to establish the efficacy of chlorpromazine in treating viral infections like COVID-19, HIV, or hepatitis. While in vitro studies and small scale trials have shown promise, larger scale human trials will be essential to determine the safety and effectiveness of chlorpromazine in this new context. Another important research area is its combination therapies. Chlorpromazine could be used in combination with other antiviral drugs or immunomodulators to create a multifaceted approach to treating infection or even chronic disease that involve immune dysregulation. Finally, we need to look at long-term side effects and the safety profile of chlorpromazine in the context of infectious disease treatment. Since it's primarily used for psychiatric conditions, there may be differing side effects when it's used in non-psychiatric conditions, and these need to be carefully evaluated.
Repurposing drugs like chlorpromazine seems like a promising approach, especially given how quickly medical needs can evolve during a pandemic. What do you think the future of drug repurposing will look like?
The future of drug repurposing is incredibly exciting, especially with the rapid advancements in biotechnology and computational methods. We have seen how COVID-19 accelerated the search for treatments, with many exciting drugs being re-evaluated for their potential effectiveness against the virus. Chlorpromazine is a prime example of a drug that has been around for decades, but its true potential is still being uncovered. The fact that we can take a drug with an established safety profile and test it in new indications means we can get results faster than starting from scratch with a completely new compound. This is not only speeds up the process of drug discovery, but also makes it more cost effective and accessible to people who need it. With the help of artificial intelligence, biomarker identification, and clinical trial networks, repurposing drugs like chlorpromazine could become a cornerstone of future medical therapies, especially when dealing with emerging infectious diseases.
As we close out this final episode of Inside Chlorpromazine, we can see that this old drug has the potential to become a new hero in the fight against infectious diseases. From its roots in psychiatric care to its potential role in antiviral therapy, chlorpromazine's journey is far from over. Thank you again, Chythanya, for being a part of this series and for sharing your expertise with us. I think we all I think we all have a renewed appreciation for chlorpromazine and the untapped potential of repurposed drugs. Until next time, stay curious and keep learning. Thank you.